Hello everyone, this is Professor Troy, and I just wanted to make a brief video explaining a little bit about bipolar disorder and depressive disorders because these can be somewhat confusing. I'm sorry I didn't make this video earlier. I was having some computer problems, but hopefully that's all sorted out and you'll have time to review this video and go over it before the exam happens next week. So first, when we talk about bipolar disorder and we talk about depressive disorders, there's a little bit of controversy between each. Depressive disorders are considered mood disorders because the main symptom of depressive disorders is mood disturbance, mainly sad mood. With bipolar disorder, we used to consider them mood disorders, and now there's considerable debate about whether or not bipolar disorder is a mood disorder or whether or not bipolar disorder is actually a psychotic disorder, and I'll get to that as we go forward. But let me talk a little bit about some of the main symptoms of depressive disorder and then the main symptom of bipolar disorder, which is mania. Okay, so major depressive disorder. Now, the first thing to understand and remember about major depressive disorder is we're not just talking about people who are really, really sad. Okay, depression is a mental illness. This is not somebody who's sad because they lost a pet or lost a loved one or a relationship ended. People with major depressive disorder or major depression are clinically, functionally impaired in some way. And they're functionally impaired because the mood symptoms of depression are so severe that they're getting in the way of the individual's ability to function normally or causing the individual significant distress. Okay, so what we're really talking about here is sadness that is beyond what we consider normal. Okay, now here are a number of the symptoms of major depressive disorder. Now you have to have a number of these symptoms, not necessarily all of them, and you have to have them for 2 weeks, and then there's one more qualifier, and I'll talk about that in a couple of seconds. So have to have loss of pleasure and motivation, helplessness, depressed mood, crying spells, changes in appetite. Some people who are depressed might eat very, very little. Some people who are depressed might eat excessive amounts. It's not just that your eating has ceased, right? We make a mistake that thinks we're too upset, or some people think we're too upset to eat. No, with depression, some people eat all the time. It's what we're talking about here is a significant change from what's normal for you. Sleep disturbance is also the same thing. Some people who are depressed sleep all the time. Some people who are depressed don't sleep at all or sleep very, very little. Some people who are depressed fall asleep fine, but then they wake up early in the morning and then they find themselves unable to fall back to sleep. They call this early morning awakening. So it's sleep disturbance. It's not necessarily just sleeping all the time. Psychomotor retardation means maybe they just move very, very slowly, or they're having physical weakness, or they might have pain, or everything just seems to be slowed down, right? It feels like they're moving in like jello or molasses, right? They just can't move as quickly as normally. Feelings of worthlessness, recurrent thoughts of suicide, both tend to be quite important and concurrent with depression. And they have to last for 2 weeks or more, okay? It can't just be that you feel this way for a day or 2 or 3 days or even a week. It's got to be 2 weeks or more. That's the first qualifier. The second qualifier is it has to be in absence of a major loss. What I mean by that is if you're experiencing the death of a loved one, let's say, heaven forbid, your spouse dies unexpectedly or even expectedly, and you're feeling these symptoms, and it's in a direct consequence of your spouse passing away or a loved one leaving you, that's not depression, that's mourning. That's a normal level of sadness in response to a traumatic event, okay? That's fine. So in that case, if there's some type of traumatic event, the loss of a loved one or something like that, we give you a year, okay? So it's okay if you're feeling most of these symptoms for up to a year. After a year, if you're still feeling those symptoms, at that point, then we say, wait a minute, this is not just normal mourning anymore. This person really, I'm not saying they should have gotten over it. I'm not saying everything should be fine, but they should be able to function normally. Remember, if you think about all of these symptoms and if you look at them carefully, the person is not functioning normally. It's not just that they're sad. It's that they're not functioning normally. If a year goes by after a traumatic loss and you're starting to function normally, it doesn't mean that you're not sad. You can be sad. Some people will be, some people won't be. But if you're functioning normally, that's not depression. If you're not functioning normally and it's been longer than a year after the loss of a loved one or some other traumatic event, then we would say it's a depression. If it's less than a year but more than 2 weeks, and you have not lost a loved one, it's depression. If it's less than a year and more than 2 weeks, and you have lost a loved one or some other traumatic event, it's not depression, it's normal mourning. Okay, that's really important to understand when we're talking about the difference between depression and just sadness, okay, or mourning the loss of somebody. Now, mania, okay? Mania is sort of poorly described as elevated or expansive mood, all right? But mania is so much more than that, okay? People that have mania on a low level might be experiencing less need to sleep, increased talkativeness. Their ideas might be jumping back and forth, thinking of a lot of different things at the same time, maybe taking unnecessary risks, feeling great about themselves, etc. Right? And that's mild mania. Okay, and if you watch that video with the Englishman for the teaching psychology video with him and Dr. Betty, if you watch that video, that's a level of hypomania or low-level mania, where the guy has sort of the racing thoughts and the grandiose ideas, and you can see what that looks like. That's at a low level of mania, and that is mania. Mania on a very high level can get very, very bad. I know people who are manic. I know of a manic patient who walked into the nurse's station of the hospital, and she physically pulled her own eye out of her head. Literally pulled it out and dropped it on the floor. And she didn't feel any pain. She was so manic that she really felt nothing. She was that manic. I know another person who had mania, and the guy actually lit himself on fire. Didn't feel the pain. I know another guy who was manic, and he held fireworks in his hands, and they blew up in his hands, and they did a lot of damage. He ended up getting infections. He never went to the doctor because he really just didn't feel the pain. They ended up having to remove some of his fingers. And prior to this, he was a chiropractor, and now he can't be a chiropractor anymore. Mania at its worst can be extremely bad. People can be psychotic when they're manic, when it gets that bad. That's why there's some debate about whether or not mania is a mood disorder or a psychotic disorder, right? It's a little bit difficult. When you start to get a very high level of mania, you start to ultimately look psychotic. And so there's some debate about if it's a mood disorder or a psychotic disorder. Okay. Now, in order to have bipolar disorder, the main symptom of bipolar disorder is mania. Okay. If you don't have mania, you cannot have bipolar disorder. If you have mania, you either have bipolar disorder, schizoaffective disorder, which we'll talk about later when we get into psychotic disorders, or it's possible that you're experiencing side effects of drug use. That's always one of the rule outs when we talk about mania. But in order to have bipolar disorder, you have to have mania. And some people with bipolar disorder don't have depression. They just have mania. It's a different type of bipolar disorder. Okay, now, I talked about hypomania before. I mentioned it a couple of minutes ago. Hypomania is a low level of mania. It's people who are manic, but they're certainly not as extreme as what I just described about the patient with the fireworks or the guy lighting himself on fire or the patient with the eye. Hypomania is a low level of mania. It's where people tend to have a lot of energy, people tend to take on a lot of different tasks, and they might not need to sleep as much. They might be a little bit irritable. That's sort of a low level of mania. If you want to see an excellent movie on with a character that has bipolar disorder, it's about something else, but one of the main characters has bipolar disorder. It's called Michael Clayton, and it's with George Clooney and a couple of other people who are pretty famous. But one of the characters in that movie has bipolar disorder, and he starts to decompensate. He's an attorney defending a large pharmaceutical company, and not pharmaceutical, sorry, a chemical company, and he starts to decompensate, and he really has a full-blown manic episode. And you can see how he behaves, and he does a very excellent and accurate depiction of what it's like for somebody to have bipolar disorder and to slip into a manic episode. So definitely worth watching. Okay. All right, let's keep going here a little bit. All right. Now, manic episodes, depressive episodes, manic episodes. Major depressive episodes can last anywhere from 4 to 6 months. Obviously, they can be longer in some people, they might be shorter in others, but they typically last about 4 to 6 months. And manic episodes typically last about 2 to 3 months. Okay, hypomanic episodes can be as short as 4 days, It can be a few weeks. It can be a couple of months. Again, this is just in general. All right. Major depressive disorder is the most common psychological disorder overall. 17% of the population has major depressive disorder or will be diagnosed with it at some point. That's almost 1 in 5. Okay. It's very, very common. All right. Now, diagnostic criteria, at least 5 of the symptoms that we talked about before, lasting for 2 weeks or more, not caused by any other disorders. People with schizoaffective disorder might evidence symptoms of depression. People with bipolar disorder have depression, but most of the time have depression unless you have bipolar, unless you have hypomania. But once you have a manic episode, you are no longer suffering from depression. So you could have the sad mood, you could have all 5 symptoms for weeks, even months, even years. Once you have one manic episode, we say that that person has bipolar disorder. They're just in a depressive episode of bipolar disorder, okay? It's sort of strange to think about, but once you have that one manic episode, you don't have depression anymore. You're dealing with bipolar disorder. Okay. Now, diagnostic criteria is 5 symptoms from the ones that I showed you on slide 2, I believe, and at least 2 weeks or more, and not caused by any other disorder, and never had a manic episode. Okay. Now, a lot of people have one depressive episode, but it's not uncommon. If you have one depressive episode, it is very, very possible to have another one. Okay. The more depressive episodes you have, the more likely you are to have another. All right. And unfortunately, the more that you have and the longer they last, the more you typically do have in the future. All right. There is hope, though. Depression typically goes away. All right. Unfortunately, it can come back. Now, as far as sex differences, women are twice as likely than men to be diagnosed with major depressive disorder. And there's a couple of different reasons for this. Hormones, social roles, etc. It's more socially acceptable for a woman to admit to symptoms of depression. Okay, I want to skip ahead because the video typically lasts about 15 minutes, so I want to talk about bipolar disorder. Bipolar disorder is very, very rare compared to major depressive disorder. About 1% of the population has bipolar disorder. However, the number one reason for admission into a psychiatric hospital is for bipolar disorder, specifically mania. People with bipolar disorder are much, much more likely to get admitted to a hospital because they start to act very erratic. They start to do things that are dangerous. They start to do things that might be harmful to themselves, might be harmful to others, or both. They tend to become aggressive. People with bipolar disorder can get violent, can get hostile. They do a lot of things that can hurt other people. And so people around them typically call an ambulance. People with bipolar disorder don't really recognize their symptoms when they start to decompensate for the most part. They typically feel very, very good. They have a lot of energy. They feel elated, but they ultimately end up not realizing that they're in the throes of a manic episode. And really, some people would argue this, but in my experience, and I've worked with many, many people suffering from bipolar disorder, in my experience, really the only way to tame the symptoms of bipolar disorder is through medication. That doesn't mean that therapy can't help them later on, but once you're in the throes of a manic episode, there is nothing that can touch this person. Nothing gets through. Okay? Now, these are just typical patterns of manic episodes. You can take a look at that. They're pretty self-explanatory. Now, there's a difference between different types of bipolar disorder. There's bipolar 1 and bipolar 2. Bipolar 1, at least one full-blown manic episode not caused by substance abuse. Bipolar 2, people with bipolar 2. Sorry, I paused the video for a second, so hopefully I'm still on track. So bipolar 2 is a little bit different than bipolar 1. Bipolar 2, focus on the depressive episodes. And the major difference between bipolar 1 and bipolar 2 is that with bipolar 2, the individual has never had a full-blown manic episode. They can have a hypomanic episode, but not full-blown manic. So again, we'll talk about schizoaffective disorder later. I kind of throw this in because I want to make sure you understand. But once you have a full-blown manic attack, and it's not caused by drugs, you have bipolar 1. unless you have schizoaffective disorder. But again, we'll talk about that later. Don't worry about it. I don't want to make it too confusing. Okay. Hopefully that made things a little bit more clear. You can take a look at the other mood disorders in there, but they're pretty self-explanatory. If you have questions, just email me, and I'll be posting a video about the next section fairly soon.